Your heart is racing, your chest feels tight, and your mind is worrying about any and everything. It's more than stress, it's anxiety, and it's messing with your nervous system. But there's a specific breathing technique that can help reduce anxiety symptoms quickly. No pills needed. Just one method backed by science that can calm your nervous system. I'm about to show you exactly how to do it, plus the science behind why it works. And I'll tell you the common mistake that most people make when they're trying to calm down. Hi, I'm Dr. Am, an integrative psychiatrist and lifestyle physician. Many women in perimenopause deal with new anxiety or worse anxiety than they previously did. They might wake up at 3 a.m. with their heart pounding, they feel irritable, or they avoid situations because they feel overwhelmed. Here's what's happening in your body. When estrogen drops during perimenopause, it affects parts of your brain that control emotions, including a region called the amygdala. Research shows that when estrogen declines in midlife women, anxiety may worsen. The amygdala is like your brain's alarm system. When estrogen drops, this alarm can become way more sensitive. Your brain might see threats more intensely than before. Also, the way you breathe can make anxiety worse. When you are anxious, you breathe fast and shallow, even up to 20 breaths per minute, instead of the normal 14 to 16. This can turn on your sympathetic nervous system, which is responsible for your fight or flight response. Faster breathing is directly linked to higher levels of stress hormones in your body. You can get stuck in a vicious cycle. Anxiety makes you breathe fast and shallow. Fast breathing makes anxiety worse. But you can break this cycle with controlled breathing. Here's a technique backed by science that can help. It's called Cyclic sighing, somewhat similar to physiological sighing. Stanford scientist Dr. Andrew Huberman and his team studied this technique. They found it works really well for quickly reducing stress in your body. Cyclic sighing was defined as a breathing pattern that emphasizes prolonged exhalations. The study found that breathwork, particularly cyclic sighing, produced greater improvements in mood and a greater reduction in respiratory rates than mindful meditation. Here's how you do it. Step 1. Take a deep breath in through your nose. Feel your lungs about 80% full. Step 2. Here's the key part. Take a second shorter breath in through your nose to completely fill your lungs. Step 3. Now breathe out slowly and fully through your mouth. Make it long and controlled. That's one cycle. Do this about 4 to 6 times. Research shows that your heart rate drops, your breathing slows, and your nervous system shifts to a calmer state. A study found something amazing. Just 5 minutes of cyclic sighing reduced anxiety and improved mood better than meditation or other breathing techniques. The long exhale was especially powerful. But why does the double inhale matter? Deep breathing, especially with that second top-off breath, helps to expand tiny air sacs in your lungs called alveoli. This helps your body exchange gases better and can help balance carbon dioxide levels in your blood. Research shows that people with panic and anxiety disorders are more sensitive to carbon dioxide. By breathing the right way, you help your body normalize these signals. Here's the mistake most people make. They take one deep breath and hold it. This actually increases tension. Your body needs the long, controlled exhale to turn on your parasympathetic nervous system, your rest and digest mode. The exhale is what moves you out of the stress response. Without it, you're just holding tension in your chest. Many women tell me that using cyclic sighing before stressful situations, during sleepless nights, or when they feel anxiety creeping in gives them a sense of control over their symptoms. Here's the truth. This breathing technique is a tool, not a complete solution. If your anxiety is constant and affecting your sleep, relationships, or daily life, you should talk to your healthcare provider about the root causes. Perimenopause anxiety involves hormone changes, but also inflammation, sleep problems, stress, and other factors. Treatments backed by science for perimenopause anxiety include 1. Cognitive behavioral therapy (CBT) and mindfulness practices. Studies show this significantly reduce anxiety and depression during perimenopause. 2. Menopause hormone therapy may help some women, especially those whose mood is sensitive to estrogen changes. However, it's not recommended just for anxiety prevention. 3. Mind-body practices like yoga, meditation, and movement therapies show moderate to large benefits for menopause anxiety symptoms. 4. Lifestyle changes, including nutrition, exercise, and sleep hygiene. 5. Medications like SSRIs are used when symptoms are severe and affect your ability to function. But before you try medications, watch this video where I discuss science-backed natural ways to treat anxiety.